We welcome you to the last session of FMGE Recall Rush. Congratulations on making this far. We hope this initiative by PrepLadder has helped you along your FMG journey. You have 5 seconds to answer each question, after which the correct answer and a brief explanation is revealed. Let us begin.
Question 1. A study was conducted to compare MMR vaccine history in children with autism and children without autism. What kind of study is being done here? Here are the options. A. Cross-sectional study. B. Cohort study. C. Case control study. D. Clinical trial. And the correct option is C. Case control study. Here is the explanation.
First of all, the salient features. Now, in salient features, I've just noted it down for you so that you don't miss out on any point. The first thing anyone is going to ask you is which type of study is a case control study design. Okay, which type? So, you've done the classification of study designs. Remember, it was broadly classified into observational and experimental. Observational mein we were not doing any intervention, we were just observing, and under observational we had two categories, descriptive and analytical, right? So descriptive epidemiology we have already covered, where we were describing the diseases in terms of time, place and person. Now when we go to the next approach, okay, where we were talking about analytical. In analytical study designs, we tend to answer, like we have discussed in detail, why and how. So to find out why and how the disease is happening, okay, the first thing is to start with a case control study design. You can take people who've suffered from the disease versus people who've not suffered from the disease and gather all the information. What type of study is a case control study design? You have to remember it is an observational analytical study. Okay, what is it? Observational analytical study. Okay, so case control study is an observational analytical study. All right, that is very, very important. Now, next, some salient features that I have written, like I told you, it's the first approach towards testing a causal hypothesis. That means whenever we plan to do an analytical study design, after describing, after formulating a hypothesis, we need to test. So test, should you go for a case control or a cohort, the first step, like when we have to test a hypothesis, the better is to go for case control, because in a case control you already have, okay, cases have occurred, all right, cases have already occurred. So you can, it's always better to start with your study with people who suffer from the disease versus who do not suffer from the disease, which will help you answer the questions why and how a disease is occurring. Okay, remember the next point, both exposure and outcome have occurred before the start of the study. Now when you will read case control with me, and towards the end this point will get more clear to you when we see the basic design also, that in a case control study cases have already occurred. Remember that you are not making cases occur, they are already diseased. Okay, and since they are already diseased, that means they have already been exposed also to some risk factors. So always remember, both exposure and outcome have occurred before the start of the study in case control. But when you will study cohort, and when you will be doing a comparison between case control and cohort, you will see that in a prospective cohort, the outcome has not yet occurred. In a retrospective cohort, the outcome has occurred, but it is determined at the time of the study begins. So that we will deal with when we talk about cohort. But right now, remember, for a case control study design, cases have already occurred, and therefore exposure has already been occurred. Now, the name is case control. So you have two groups, one who are the cases, who are the diseased, and the other who are the controls. Controls means what? The non-diseased. Okay, they have not yet suffered from the disease. So you always need a comparison group. And like I told you in classification of study designs also, that when you are talking about analytical study, what is the difference between descriptive and analytical? In descriptive, you never have a comparison group, but in analytical study, you always have a comparison group. So you will always need a control or comparison group. Okay, and then the relevance of this last point, it proceeds backwards. It's a retrospective study. You will be looking at the relevance of this point when we look at the study design.
Question 2. A surveyor visits a household consisting of a 35-year-old man, his wife who is 6 weeks pregnant, and a 3-year-old child. The man's brother along with his wife is currently visiting them for a month owing to winter vacation. What type of family would the surveyor classify the household? Here are the options. A. Joint family. B. Nuclear family. C. Extended family. D. Third generation family. And the correct option is B. Nuclear family. Here is the explanation.
Nuclear family is also known as elementary family. So what is nuclear family? A married couple. It's just one couple, okay? A married couple with their dependent children, okay? With their dependent children. Here I'd give you this thing also. Now suppose there's some couple who's got newly married and they are not, and the a male person is not putting up with his parents. So the couple has gone and is residing at some other city or town. They are also nuclear only. But technically the definition is a married couple with their dependent children is a nuclear family.
Question 3. The ideal per capita space for students in a classroom should be. Here are the options. A. Greater than 5 square feet. B. Greater than 10 square feet. C. Greater than 15 square feet. D. Greater than 20 square feet. And the correct option is B. Greater than 10 square feet. Here is the explanation.
Per capita space has come so many times, more than 10 square feet. That means minimum per capita space offered should be at least 10 square feet.
Question 4. What is the denominator in the infant mortality rate? Here are the options. A. 100. B. 1000. C. 10,000. D. 1 lakh. And the correct option is B. 1000. Here is the explanation.
Infant mortality rate was supposed to be lowered to 25 per 1,000 live births.
Question 5. The highest birth rate is seen in which stage of the demographic cycle? Here are the options. A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. And the correct option is A. Stage 1. Here is the explanation.
This is stage 1. Now, when a country forms, what do you think is happening to the birth rate and death rate? Obviously, when a country forms, we use the same colors, okay? Yeah. So, when a country forms, what happens? Birth rate is also high. And what happens to the death rate? That is also high. So when a country is in its starting phase, okay, what happens? Both crude birth rate and crude death rate are high. Okay, both CBR and CDR are high. So if suppose this pencil is the birth rate and my hand is the death rate, okay, both are high. So when both CBR and CDR is going to be high, what is going to happen to the population? Will it increase, decrease, or will it be stable? It will be stable.
Question 6. A primigravida delivers a healthy baby via normal delivery. After how many hours should she initiate breastfeeding? Here are the options. A. Within 1 hour. B. After 1 hour. C. After 4 to 6 hours. D. After 24 hours. And the correct option is A. Within 1 hour. Here is the explanation.
Breastfeeding should be done. Okay, very important question, the guideline. When is breastfeeding initiated, guys? When is breastfeeding initiated? Earlier it was said like 1 hour in normal delivery, 4 hour in C-section. Now it is nothing like that. Okay, as soon as possible after birth. Okay, as soon as possible after delivery. Okay, as soon as possible after delivery, breastfeeding should be initiated.
Question 7. Eligible couple registers are maintained at which of the following centers? Here are the options. A. PHC. B. CHC. C. Subcenter. D. District Hospital. And the correct option is C. Subcenter. Here is the explanation.
What is her very important function? She maintains a special register which is known as, which you have studied also, maintains eligible couple register. Okay, who is responsible for maintaining the eligible couple register at the subcenter? Multi-purpose worker female. This question has come many times. Eligible couple register is also maintained at the subcenter level. The responsibility is of the ANM. Okay?
Question 8. You are administering an 8-month-old infant with vitamin A supplements over the course of 2 consecutive days. What is the recommended dose? Here are the options. A. 25,000 international units. B. 50,000 international units. C. 1 lakh international units. D. 2 lakh international units. And the correct option is C. 1 lakh international units. Here is the explanation.
So when the child is up to 6 months, up how much dose do you give? 50,000 international unit, 50,000 international unit and 50,000 international unit. 6 months to 1 year, it is 1 lakh international unit, 1 lakh international unit, 1 lakh international unit. And more than 1 year, everybody, it is 2 lakh international unit, 2 lakh and 2 lakh international unit.
Question 9. An 8 weeks pregnant woman working in industry consults a doctor. According to the ESI Act, what is the duration of maternity leave that she can take? Here are the options. A. 4 months. B. 28 weeks. C. 26 weeks. D. 9 months. And the correct option is C. 26 weeks. Here is the explanation.
Maternity benefit. Okay, so we all know maternity benefit now is 6 months, but to be more precise, maternity benefit is offered at 100% wages for 26 weeks. Okay, in case of MTP, all right, in case of MTP, okay, so in case of MTP, we can in fact just put over here, in case of MTP also this is offered at, 100% wages for 6 weeks. And in case there is some pregnancy-induced confinement, okay, pregnancy-induced confinement, meaning certain disease or something, then also it is offered at 100% wages for 4 weeks. Okay.
Question 10. Which of the following biomedical waste is disposed of in a yellow bag? Here are the options. A. Blood bag. B. Gloves. C. Sharps. D. Urine bag. And the correct option is A. Blood bag. Here is the explanation.
So expired discarded bed, cytotoxic drugs, yellow bag, microbiology or clinical lab, biotechnology waste, including blood bags and blood samples. I told you blood bag, yellow. Blood transfusion set, yellow. So blood bags including blood transfusion sets, again just reminding you, yellow. Okay.
Question 11. Which of the following is used to estimate relative risk, RR? Here are the options. A. Case control study. B. Cohort study. C. Randomized controlled trial. D. Cross-sectional study. And the correct option is B. Cohort study. Here is the explanation.
What are the ways by which we can measure the strength of association in a cohort study? Okay, so the first one, what is done is something known as relative risk calculation. Second one, something is calculated which is known as attributable risk. And one more thing which is calculated, that is known everybody as population attributable risk. Okay, this is population attributable risk. So the measures of strength of association are 3: relative risk, attributable risk and population attributable risk.
Question 12. All the following are true regarding the urban primary health center staff except. Here are the options. A. Medical officer. B. 3 staff nurses. C. 1 lab technician. D. 1 pharmacist. And the correct option is B. 3 staff nurses. Here is the explanation.
Staff at PHC, so we should know their names at least. If you are asked about staff at PHC, we know 13 to 18 in type A and 14 to 21 in type B, but who are they? Now comes a medical officer. So you're going to have a medical officer. Now medical officer over here is essential, okay, he's one of the essential people who should be there. Ayush officer is desirable, okay. Ayush officer is the one who is desirable, but of course medical officer is essential and Ayush is the one who is desirable over here. Okay, so that is staff at PHC, 2 very important people. Now third, In the sub-center, you had multi-purpose worker, male and female. Yes. So here, who do you have as the health workers? So here it is health assistant. This is very important. Health assistant male. Okay. And we also have a health assistant female, guys. Okay. Health assistant male and health assistant female. Now, health assistant female is also goes by the name of LHV. LHV means what? Lady health visitor. Okay, health assistant female also goes by the name of LHV. LHV is nothing but lady health visitor. Other than this, we are also having one pharmacist. Technically, a pharmacist in India should be present for every 10,000 population. Okay, one pharmacist, one lab technician. Okay, they are the most important staff which is posted at PHCs. We can't do all the staff members, but the most important ones: medical officer essential है, आयुष officer desirable है, health assistant male and female. Health assistant female also goes by the name of lady health visitor. Then we also have a pharmacist and we also have a lab technician.
Question 13. If a wide range of values are present in a community, what is the best measure of central tendency? Here are the options. A. Mean, B. Mode, C. Median, D. Standard deviation. And the correct option is C. Median. Here is the explanation.
When we have wide range of values, this came as an MCQ. Okay, wide range of values in a data set. Okay, we have what? Wide range of values in a data set. So what is the measure of central tendency when you have wide range of values? Wide range of values again mean that there are outliers present. Okay, wide range. So that is making my data skewed. So what will be the best measure of central tendency? Median.
Question 14. 4 to 8 speakers talk about a specific topic in front of a large audience. There is no particular agenda, set speech, or order of speaking. In the end, there is interaction with the audience. What is this mode of communication best known as? Here are the options. A. Panel discussion, B. Symposium, C. Workshop, D. Seminar. And the correct option is A. Panel discussion. Here is the explanation.
Difference between the two. Okay, panel and symposium. Now, in both guys, you have 4 to 8 experts. Okay, and both are two-way, or like we call it, Socratic method of data collection, Socratic method of health communication. Okay, this also. Now you would ask me, ma'am, then what is the difference? 4 to 8 experts are here also, and this is also a Socratic method. Okay, two-way. So let us try to do this by looking at the difference between the two. Okay, panel and symposium. So straight away, let us go and make a distinct panel discussion, and there is something known as symposium. Very famous question. Okay, it's like one of the favorite topic of examiners. Okay, question keep coming. So now let us do together. We'll study it together. There are 4 to 8 experts here. Here also you have 4 to 8 experts. Okay, all right. This is also what? Two-way, Socratic. This one's also what? Two-way, Socratic. But in a panel, remember, there is no set agenda, there is no set speeches, no set order of speeches. Let me first write it, okay? Here what is happening? There is always, guys, a set agenda, set speeches, and also there is a speaking. Set order of speaking. That means in panel discussion, I have not conveyed the agenda before to the expert. There is no set agenda, there is no set order of speaking, that who's going to speak after whom. There are no set speeches. Okay, if you've seen news channels, okay, they are a perfect example of panel discussion. Everywhere, both the places, we have a moderator. Okay, so the moderator is there, but the panelists whom we have called, they have not been given specific topics. They can intervene, they can say in between, all right, and moderator is just trying to moderate the discussion. So what is the next point which is very, very important over here is that the experts can discuss among themselves. That means they can intervene in between. Okay, what can they do? They can intervene in between. But in symposium, experts cannot intervene in between. Okay, experts, what cannot they do? Experts cannot intervene in between. Okay, they cannot intervene in between. They cannot discuss among themselves. They cannot discuss among themselves. All right, that's a very important thing which can come. Then next, obviously, do you have an audience? Yes, here it's two ways audience present. Here also audience is present. Do we take a feedback? So yes, feedback is definitely taken. Here also to some extent it is definitely taken. But what is the most important difference that you need to know? That in a panel there is no set agenda, there are no set speeches, there is no set order of speaking. But in a symposium it is. And in a panel the experts can intervene, can discuss among themselves. But in a symposium they cannot do that.
Question 15. At what age is the first dose of hepatitis B vaccine given? Here are the options. A. Birth. B. 6 weeks. C. 10 weeks. D. 6 months. And the correct option is A. Birth. Here is the explanation.
Vaccine of hepatitis B, we all know it is a recombinant vaccine, monovalent. It is given at 0, 1 and 6 months. Now suppose you took your 1 month dose and you forgot, you did not then take your 6 months injection. Okay, when you remember, you please take it. Don't restart your vaccination.
Question 16. The number of maternal deaths per 100,000 live births is called. Here are the options. A. Maternal mortality rate. B. Maternal mortality ratio. C. Infant mortality rate. D. Perinatal mortality rate. And the correct option is B. Maternal mortality ratio. Here is the explanation.
MMR over here could be two things. It could be either maternal mortality rate. This will be taken up again in the topic of preventive obstetrics also. Or you can also say maternal mortality ratio. So what is the difference? I'll just brief you over here. Whenever you say rate, okay, rate means numerator has to be a part of denominator. Ratio means numerator is not a part of denominator. So over here, when I talk about maternal mortality rate, okay, when I talk about maternal mortality rate. Now, since I say rate, my numerator has to be part of denominator. N has to be part of D. So this will mean what? Total number of maternal deaths. Okay, I told you for maternal mortality we have the multiplier as 1 lakh. Okay, so total number of maternal deaths. Now it is rate, so numerator has to be part of denominator. Per 1 lakh women in which age group? Per 1 lakh women in reproductive age group. And what is the reproductive age group that we consider? 15 to 49 years. But in case I said maternal mortality ratio, okay, if I say maternal mortality ratio, what is this? So this is nothing but total number of maternal deaths. Now ratio, in ratio, numerator is not supposed to be part of denominator. So here it's going to be the same per 1 lakh live births. Okay.
Question 17. Vaccines given at birth. Here are the options. A. Pentavalent, MR, high B, BCG, OPV0, MR, C, BCG, OPV0, hepatitis B, D, BCG, IP, hepatitis B. And the correct option is C, BCG, OPV0, hepatitis B. Here is the explanation.
So first, at birth we give BCG, OPV0 and hepatitis B birth dose. Now please don't worry right now about the route and the site and the dose. I'll tell you about that. How do you have to remember? Right now we are just looking at the schedule, when which vaccine is given. So at birth it is BCG, OPV0 and hepatitis B.
Question 18. A patient from a northeastern state was diagnosed to have an infection with P. falciparum malaria. What is the most appropriate treatment for this patient? Here are the options. A. Artemether plus lumefantrine. B. Sulfadoxine plus pyrimethamine. C. Chloroquine. D. Mefloquine. And the correct option is A. Artemether plus lumefantrine. Here is the explanation.
Plasmodium falciparum, very important. Now for Plasmodium falciparum it is ACT. What is this? This is artemisinin combination therapy. Okay, what is it? Artemisinin combination therapy. That is what is for Plasmodium falciparum. Now this ACT treatment, okay, has been divided into two categories. Okay, artemisinin combination therapy. This could be either for other states, remember it, or it is for northeastern states. Okay, either for other states or northeastern states. If you talk about other states, it is ACT-SP. And if you talk about northeastern states, it is ACT-LM. Now, what is ACT-SP? So, here you will see ACT-SP. So, in this you have to remember it is artesunate plus ACT artesunate, okay, plus sulfadoxine plus pyrimethamine. And what is ACT-LM? So it's the same thing, but ACT-LM mein you have lumefantrine plus artemether. Okay, so in northeast states it is ACT-LM and in other states it is ACT-SP.
Question 19. The best method of teaching an urban slum about ORS. Here are the options. A. Lecture. B. Role play. C. Flashcards. D. Demonstration. And the correct option is D. Demonstration. Here is the explanation.
Which is known as demonstration. Now demonstration, the first thing, it is two-way or Socratic. Now this relies on, okay, seeing is believing, and learning by doing. Okay, so it relies on the principle of seeing is believing and learning by doing. Okay, that's what it relies on, the principle. Now remember, this is a very important or efficient method for behavior change. Okay, it's one of the most efficient method for behavior change. Okay, one of the most efficient method for behavior change. Now when you go to a community or something, okay, you want them to learn a technique, okay, you first demonstrate and then ask someone from the community to come and do the same thing. So it's an efficient method of behavior change because it is involving community participation. Okay, so what can we use? Example, ORS demonstration, ORS preparation, okay, ORS preparation, application of scabies ointment, okay, application of scabies ointment. All right, then
Next, installation of a hand pump, okay, installation of hand pump. All right, then construction of sanitary latrines, okay, all these construction of sanitary latrines. Now, if we show them how it's being done, no, it has a high motivational value, okay. This technique has a high motivational value. In hospital teaching, in clinical teaching as well, this method has high value. So, remember these buzzwords, okay. It is seeing is believing and learning by doing. Now, when they actually see how a hand pump is installed, it also gives them kind of motivation to use it, okay. Construction of sanitary latrines and its relevance. So, that is what is demonstration. ठीक है?
Question 20. To avoid overcrowding, what is the maximum number of people allowed to live in a house with 2 rooms? Here are the options. A. 2 people, B. 3 people, C. 4 people, D. 5 people. And the correct option is B. 3 people. Here is the explanation.
Person per room criteria, okay. So, when you talk about person per room criteria, overcrowding will be seen, okay, if in one room we have more than 2 persons, okay. If in 2 rooms, what happens? There is more than 3 persons. Okay, if in 3 rooms everybody, there is more than 5 persons. That is person per room. So, overcrowding is said to be present if in one room there is more than 2%, 2 rooms there is more than 3%, 3 rooms there is more than 5%.
Question 21. During your rural posting, you are asked to educate a small, uneducated village about the importance of routine antenatal care for pregnant mothers. You want to deliver some statistical data to emphasize its importance. Which of the following is the best way to do so? Here are the options. A. Pictogram, B. Line diagram, C. Histogram, D. Frequency polygon. And the correct option is A. Pictogram. Here is the explanation.
Next method of qualitative data representation, what is this? This is nothing but a pictogram. Okay, when you have to teach something to a layman, okay, to an illiterate person, I want to teach something to an illiterate person, we can draw what is a pictogram. Okay, now suppose I want to teach my 5-year-old daughter simple maths, okay, so I want to teach her addition, subtraction, I can use this. Alright, now why did I call her illiterate? Although she is able to read and write, because her age is less than 7 years, okay. So, pictogram is for a layman, someone who is illiterate, okay. Now, see, a popular method of presenting data to the man in the street and those who cannot understand orthodox chart. So, pictogram, okay. All this is quantitative methods. We will be talking about them in just a while.
Question 22. Which of the following is used to reduce the selection bias in a clinical trial? Here are the options. A. Selecting the population. B. Intervention. C. Randomization. D. Written informed consent. And the correct option is C. Randomization. Here is the explanation.
To say what is the importance of randomization? How is it helpful? Okay, I can also ask you, what is the meaning of random in randomization? Okay, what is the meaning of random in randomization? So, what is the meaning of random in randomization? See, if I ask you random, it's a simple English word. What does it mean? Random would mean something which is haphazard or something which is disorganized. But random in randomization means, okay, this is very important. What is the meaning of random in randomization? So, when I talk about random in randomization, it means equal and known chance. This is important. Okay, it means what? Equal and known chance. Okay, what does it mean? Equal and known chance. What does this mean? That every study participant, every patient is going to get an equal and known chance of being allocated either into the treatment group or in the control group. If there are 100 people, 100 chance everybody would get to get allocated either in the treatment group or the control group. So every random and randomization means equal and known chance, meaning every participant, okay, every study participant, okay, every study participant will get what? Every study participant will get an equal and known chance of being allocated into either the treatment group, which is the study group, or the control group, which is the placebo. Like every participant, by this technique of randomization, every participant will get an equal and known chance. So when every participant gets an equal and known chance, what is going to be the advantage of that? Why did I do randomization over here? Number one, the advantage, okay, it is going to eliminate, very, very important, since every participant gets an equal and known chance of being allocated into either the treatment group or control group. So it eliminates what is known as selection bias, okay. It will ensure comparability between the two groups. So it eliminates selection bias by ensuring comparability, okay. This is what comes in your exams, by ensuring comparability between the two groups. So it eliminates selection bias by ensuring comparability between the two groups. And
Question 23. Which of the following is responsible for maintaining the births and deaths in India? Here are the options. A. Sample registration system. B. Census. C. Death certificate. D. Lay reporting. And the correct option is A. Sample registration system. Here is the explanation.
Very important system, okay. It's like most of the PYQs turn up from this. SRS. Now, nobody will say SRS is sample registration survey. No, it's a system, okay. So, there are a lot of points for this that you must know, okay. So, SRS. The first point that you must know, it is the most reliable and efficient, okay, health information collecting system in India. You will say why? You'll ask me why? Health information system, health information collection system in India, okay. So it's the most reliable and efficient health information system collection in India. Health information collection system in India. Why? Because it is a dual registration. It's based on dual registration, or it is a dual recorder, okay. It's based on dual recorder. Dual recorder means what? It is a dual record system, okay. That means, okay, this is very, very important. See, it's based on dual registration, or it's a dual recorder system. Why? Because here we have a part-time enumerator, okay, a part-time enumerator who can be any health personnel who can collect the information. So whatever the data it is being collected by the part-time enumerator is verified by a full-time enumerator, okay. So it is a dual recorder collecting system, and it is collected every 6 monthly, okay. It's done every 6 monthly. Not because it's being done every 6 monthly that it's most efficient. No, because the data is being collected by two people, okay. First, there's a part-time enumerator, and then that data is being verified by a full-time enumerator. So, a very important question is, which is a dual recorder health information collecting system? So, it is SRS, okay. It is conducted every 6 months, alright. It is conducted what? Because the part-time will do 6 months, then will be verified by the full-time enumerator. So, it is conducted every 6 months, but it does what? It provides us with what? It provides us with annual estimates, okay. It provides us with what? Annual estimates. Like you will get the SRS information. The SRS bulletin is released every year. SRS 2020, 2021, 2022. So it provides us with what? Annual estimates. Okay. SRS bulletin is released every year. It's being conducted every 6 months. It's a dual recorder system by a part-time enumerator and a full-time enumerator. Now, another important question is that SRS provides us information on what? So, information which is provided, alright, this is a MCQ. In fact, it's a PYQ. Okay, information provided by SRS. So, what are the informations that it provides us? Number 1, crude birth rate. Number 2, crude death rate. Okay, annual growth rate of a country. Okay, annual growth rate. Other than that, infant mortality rate. Okay, maternal mortality ratio. Okay, it can also provide us information on neonatal mortality rate. Okay, under 5 mortality rate. All right, all this information is being provided by SRS. Okay, this
Question 24. In a normal curve, what is the percentage of the distribution that falls within one standard deviation of the mean? Here are the options. A. 68%, B. 34%, C. 99%, D. 95%. And the correct option is A. 68%. Here is the explanation.
which is mean, this point of coincidence mean is equal to median is equal to mode. So that means mean, median, mode all are lying on this green line. Okay. So mean plus minus 1 SD covers 68% of observations. That's one very important point. Point number 9, mean plus minus 2 SD covers, guys, 95% of observations. And point number 10, mean plus minus 3 SD covers 99% observations. Remember this. Okay, so mean plus minus 1 SD means this. Okay, this is going to cover, they cover what? 68% observation. Mean plus minus 2 SD covers 95% observation, and mean plus minus 3 SD is going to cover 99% observation.
Question 25. You are a doctor in a village. A 1-year-old child who is not taking feeds presents with fever and cough for 2 days. On examination, he is calm, with a respiratory rate of 51 breaths min, and stridor is present. According to INI-CET, Integrated Management of Neonatal and Childhood Illnesses. How is he classified? Here are the options. A. Pneumonia, B. Cough and cold, C. Severe pneumonia, D. ARDS. And the correct option is C. Severe pneumonia. Here is the explanation.
Pneumonia classification and management, which is very important. See, first of all, you have to, whenever you get a question on ARI management, you have to first see what is the age of the child, because the classification is divided into two. First, the age is up to 2 months. Or is the child falling in this category, 2 months to 5 years? This is the first thing that you have to pay attention to. Is the child up to 2 months, or is the child between 2 months to 5 years? Okay. Now what happens? The first thing that you're going to note over here, okay, you are going to look for the symptoms and you're going to assess the signs and all that. So you will see, you have to look for 2 things, guys, chest indrawing and fast breathing. Okay? So if there is no first thing in both the situations, you will look for chest indrawing, no chest indrawing, and or fast breathing. I'll tell you what is chest indrawing. Okay, so chest indrawing is when the baby breathes in, the lower chest wall goes in. Okay, that you have to see. So if there is no chest indrawing or fast breathing is rule of 60, 50, 40. That I'm going to write in a separate slide. Okay, so if there is no chest indrawing and or fast breathing
if both these things are not there in both the classifications, you will call this as no pneumonia or simple cough and cold. Okay, in both the classifications, you're going to refer it as no pneumonia, simple cough and cold. Okay, but what is the next one that you're going? This is the first situation that can arise. Okay, what is the second situation in both the groups? If you see chest indrawing and or chest indrawing and fast breathing is there, or chest indrawing alone or fast breathing alone. Okay, and or fast breathing. Okay, and or fast breathing. Similarly, here also chest indrawing and or fast breathing. Now, if the baby is up to 2 months, this will be labeled as, the baby will be labeled as a case of severe pneumonia. But if the baby is from 2 months to 5 years, the baby will be labeled simply as a case of pneumonia. Okay, did you see the difference? Up to 2 months, if chest indrawing and or fast breathing is present, severe pneumonia. But 2 months to 5 years, chest indrawing and or fast breathing is present, you will just call it as pneumonia. Let me take the liberty over here and tell you about fast breathing. Okay, what is fast breathing? Please remember, fast breathing follows a rule. Okay, which rule? Rule of 60, 50, 40. Now you will ask me, what is this rule? So the rule of 60, 50, 40 is, if the baby is up to 2 months, then respiratory rate more than 60 breaths per minute is fast breathing. Okay, if the baby is 2 months to 12 months, okay, 2 months to 12 months, then respiratory rate more than 50 breaths per minute, everybody, is fast breathing. And if the baby is, okay, 1 to 5 years, then respiratory rate more than 40 breaths per minute, okay, it will be considered as fast breathing. This is very, very important. How will you assess that it's fast breathing? So here you're going to follow a rule of 60, 50, 40. If the baby is up to 2 months, respiratory rate of more than 60 breaths per minute is fast breathing. 2 months to 12 months, respiratory rate of more than 50, and 1 to 5 years, more than 40 breaths per minute. Okay? Next, then you're going to have a third situation. So the third situation is, remember, here we are still talking about 2 months, and here we are talking about 2 months to 5 years. Okay? But for fast breathing, we have classified into up to 2 months, 2 months to 12 months, and 1 to 5 years. Now, up to 2 months, the next situation, if the baby presents with, guys, danger signs. Now, what are the danger signs that you will see, which were written before also? Okay, like the baby is having convulsions, okay, or there is baby is extremely lethargic, okay, lethargic or unconscious, okay, are abnormally sleepy. Same thing, but we'll write it here, abnormally sleepy, okay, or difficult to wake, yeah, difficult to wake. Then stridor in a calm child, okay, so like we had studied over here, okay, so stridor in a calm child, okay. Other important thing is not feeding, not breastfeeding, okay, not taking fluids, yeah, not taking fluids. Cyanosed baby, very high fever, okay, high fever, all these things if you see, then similarly these are the danger signs here also, okay, same danger signs. Now, based on that, how are you going to classify? So, if it's a up to 2-month-old baby, that will be very severe pneumonia. And if it's a 2-month to 5-year-old baby, we will only call it as severe pneumonia. Did you understand? This is the classification. Extremely important, guys. Let's have a look at it once again. All you need to know is that first, whenever you get a question, look at the age. According to the age, you will see that whether the classification is falling in up to 2 months or 2 months to 5 years. If there is no chest in drawing, no fast breathing, no pneumonia, simple cough and cold. If there is chest in drawing and fast breathing, but both not necessary, either of the two can also do, chest in drawing or fast breathing. Up to 2 months, the classification is severe pneumonia. 2 months to 5 years, it is pneumonia. And how are you going to classify fast breathing? Rule of 60-50-40. Then, if danger signs is there, up to 2 months, you will assess as very severe pneumonia, and 2 months to 5 years, you will assess as severe pneumonia.
Question 26. A worker in a sugarcane factory is at risk of developing? Here are the options. A. Anthracosis, B. Sidrosis, C. Bagasosis, D. Bicyanosis. And the correct option is C. Bagasosis. Here is the explanation.
Exposure to organic or soluble dust. This is bicystinosis. Now, bicystinosis is due to exposure to cotton dust. Okay, cotton dust fibers in textile industries, jute industries. Bagasosis is exposure to sugarcane fibers. Okay, tobaccosis is because of tobacco. All right, farmer's lung. Now, farmer's lung is seen in exposure to moldy hay or grain dust, you can say. Okay, bird fancier's lung is because of bird droppings. Okay, so you could be asked that which one is due to inorganic, you could.
Question 27. Which of the following bags' contents are treated by incineration? Here are the options. A. Yellow, B. Red, C. Blue, D. Black. And the correct option is A. Yellow. Here is the explanation.
4 categories of biomedical waste according to the latest guidelines. Okay, there's a yellow bag, there's a red, there's a blue, and there's a white. There's no black bag or a black color as a biomedical waste category. All right, black is for general waste. Okay, but we have yellow, red, blue, and white. In yellow, all infectious waste go, may or may not be pre-treated. And the method of disposal, okay, the method of disposal or the technique of disposal. All right, so the method of disposal, everybody, is incineration for yellow bag contents.
Question 28. Orthotolidine test is used to determine? Here are the options. A. Nitrates in water, B. Nitrites in water, C. Free and combined chlorine in water, D. Ammonia content in water. And the correct option is C. Free and combined chlorine in water. Here is the explanation.
What are these tests? Orthotolidine test, and OTA is orthotolidine arsenite test. Now, what are the questions that come from this? Okay, so when we add the reagent, which is orthotolidine, or if we are using orthotolidine arsenite test, again there will be a color change. The color change which you're going to see in the first 10 to 15 seconds is free chlorine. After that, whatever color change you see would be due to effect of free as well as combined chlorine. So, all that I'm going to write for you. See, the first point from here, okay, on addition of OT reagent, orthotolidine reagent, or OTA reagent, orthotolidine arsenite reagent, the color will change to, there is a color change to yellow. Okay, there is a, like Horrocks apparatus, there was blue, here yellow. So, the color change in the first 10 to 15 seconds is what is free chlorine. After that, it is due to the effect of both free and combined chlorine. So, in the first 10 to 15 seconds, the color change that we see yellow, that is due to free chlorine. Second, okay, second point which I want you to add over here from these two tests is, alright, OTA test can detect both free and combined chlorine separately. Let me first write the points, okay? These are all MCQs, guys. Both free and combined chlorine separately. And you know what is free and combined chlorine now? The total chlorine added to water is free plus combined. So OT test can detect, alright, OT test can detect free chlorine separately. The color change which happens in 10 to 15 seconds. Fourth point, OT test can also detect, guys, combined chlorine, but not separately. It cannot detect combined chlorine separately. Then how can it detect combined chlorine? It is total chlorine minus free chlorine. You just read the total dose of chlorine added to water to disinfect is combined plus free chlorine. Okay, so you already can calculate free chlorine from OT test. So combined would become total minus free chlorine. So which test is better? Alright, so remember OTA test, okay, OTA test is better than OT test, okay, in detecting what? In detecting free / residual chlorine, okay. Why? Because it is able to detect both free and combined chlorine separately. At the same time, see, OTA test is better than OT test as it
Question 29. Two vaccines, measles and the pentavalent vaccine, are used during an immunization program. Which of these vaccines has to be discarded? Here are the options. A. Both. B. Measles. C. Pentavalent. D. None. And the correct option is B. Measles. Here is the explanation.
Guys, there's something that I want to ask you. Suppose I'm conducting an immunization session here, okay, and I use a BCG vial. So I reconstitute it. Now, whenever we reconstitute, we need to add a diluent so it doesn't have any preservative or anything in it, okay. So now, can I, like, if suppose some amount of vaccine is still left in the vial, can I reuse it in subsequent sessions? If it is maintained in proper cold chain conditions, can I reuse those vaccines? No. So what you have to remember, that reconstituted vaccines, okay, reconstituted vaccines, because we are going to add a diluent to it, okay, can be used, okay, can be used up to a certain time limit, okay, up to a certain time limit, meaning it cannot be used in subsequent sessions. Like if you talk about BCG, it has to be used up to 4 hours, okay. If you talk about measles, or if you talk about measles rubella, this also should be used up to 4 hours. If you talk about Japanese encephalitis vaccine, this has to be used within 2 hours. And if you talk about yellow fever vaccine, it should be used up to half an hour, okay. So reconstituted vaccines can be used up to a certain time limit. So BCG vaccine, we are going to use it up to how many hours? Up to 4 hours. Measles or measles rubella, we can use it up to 4 hours. Japanese encephalitis, again up to 2 hours, and yellow fever vaccine, again up to half an hour. All right. So that means reconstituted vaccines can be used up to certain time limit. But what about these T series vaccines and PO, or the liquid vaccines? Can they be used in subsequent sessions? Yes. That is what is the concept of open vial policy. Okay, open vial policy simply means that it allows the reuse of partially used vials of applicable vaccines. Okay, so open vial policy simply means that vaccine vials, okay, vaccine vials, okay, once opened, all right, can be reused. See, the name is open vial policy. So vaccine vials once opened can be reused, okay, in subsequent sessions. Can be reused in subsequent sessions, okay. They can be reused in subsequent sessions up to how many days? Up to, very, very important, up to 28 days. Okay, vaccine vials once opened can be reused in subsequent sessions up to 28 days, provided, guys, provided, okay, provided they are maintained, okay, provided they are maintained in appropriate cold chain conditions, okay, provided they are maintained in appropriate cold chain conditions. Now, why would I want to reuse up to 28 days? Obviously, in order to reduce wastage of vaccines. Okay, in order to reduce wastage of vaccines. Now, reconstituted vaccines we cannot use, okay, because we are reconstituting it, then only we are adding a diluent to it. We cannot use it. But the liquid vaccines that we have, the vaccine vials once opened, they can be reused in subsequent sessions up to how many days, everybody? Up to 28 days, provided they are maintained in appropriate cold chain conditions. And why would I want to reuse in subsequent sessions? What is the need? To reduce wastage of vaccines. Okay, my next question to all of you would be, or your question to me should be, that ma'am, which vaccines follow open vial policy? This has become a very famous PYQ. It's been coming for the last 1 to 2 years consecutively in almost all the exams. Okay, so the question which arises is that which vaccines follow open vial policy and which vaccines do not follow, obviously, right? So which vaccines follow open vial policy and which vaccines do not follow? So which vaccines follow open vial policy? So for this, what is your mnemonic? You just have to remember the liquid vaccines. So liquid vaccines was, okay, so the bigger answer to this is all the liquid vaccines. And what were the liquid vaccines, guys? The T series vaccines, okay, T series vaccines plus liquid means PO, PIO, PO, drink. So liquid is drink. So in T series vaccine, I just told you what are those? Hepatitis B, pentavalent, okay, pentavalent vaccine, DPT vaccine, TD vaccine. So all these T series vaccine, they follow open vial policy plus PO. So what does P stand for, everybody? Like I just said, PCV, IPV, OPV. So you just have to remember that which vaccines follow open vial policy, the liquid vaccines, which are your T series vaccines, plus PO. So obviously the next question again that arises is that which vaccines do not follow open vial policy, isn't it? The next question would be that only, that which vaccines do not follow open vial policy. So which vaccines do not follow open vial policy? Very easy. Which vaccines do not follow open vial policy? So the answer to this are the reconstituted vaccine. Okay, so here you will remember that it is BCG, measles or measles rubella vaccine, okay, Japanese encephalitis vaccine, yellow fever, and also for your knowledge, rotavirus vaccine. Okay, rotavac is used. So rotavirus vaccine also does not follow, okay, also does not follow open vial policy. Okay, rotavirus vaccine also does not follow open vial policy. Okay, so which vaccines do not follow open vial policy? These. And which vaccines follow? T series plus PO. That means vaccine vials once opened, they can be used up to 28 days, provided all those conditions that we just read have been fulfilled. Okay.
Question 30. The average number of children a woman would have if she were to pass through her reproductive years bearing children at the same rates as the women in her age group is called. Here are the options. A. General fertility rate. B. Total fertility rate. C. Gross reproduction rate. D. Net reproduction rate. And the correct option is B. Total fertility rate. Here is the explanation.
What is total fertility rate? Okay, next thing that we are going to do is, which is very, very important, is TFR. Okay, so in this order you're going to read, and the next thing that we are going to study, okay, after this is, so you've studied CBR, GMR, GMFR, age specific and age-specific marital fertility rate. The sixth one that you're going to read is TFR. It's very, very important. Okay, total fertility rate. Now, here it's written something that total fertility rate, all right, total fertility rate is computed by summing age-specific rates for all age groups. Okay, but what exactly is TFR? Okay, so total fertility rate is simply the average, okay, the average or total number of children, all right, the average or total number of children a woman will have, okay, a woman will have throughout her reproductive lifespan, meaning throughout 15 to 49 years, okay, bearing children at the same rate, okay, bearing children at the same rate as the woman in each age group. So, what did I write? Total number of children means the average or the total number of children a woman will have throughout her reproductive lifespan, bearing children at the same rate as the woman in each age group. Okay, so the reproductive lifespan of a woman is from 15 to 49 years. So, how many children she's going to have throughout that period? Okay, there's a way of saying it that it is computed by summing the age-specific fertility rate for all ages.
Question 31. The most sensitive index of recent transmission of malaria is? Here are the options. A. Spleen rate. B. Infant parasite rate. C. Parasite density index. D. Slide positivity rate. And the correct option is B. Infant parasite rate. Here is the explanation.
Right, then another one that I want you to remember over here is infant parasite rate. See, enlargement, average enlarged spleen means on an average how many children 2 to 10 years are showing enlargement of spleen. But question would come from infant parasite rate. So, infant you know is 0 to 1 year. So, it is simple number of infants showing malarial parasite in their blood films. Okay, but they don't ask the definition. More important over here, they are asking is it is an indicator of recent malaria transmission in a community. Okay, so it is an indicator of recent malaria transmission in a community. And what is the formula for infant parasite rate? So you will just write total out of the total infants examined, okay, how many infants are positive for malarial parasite in a year. Since its rate, the multiplier is 1000, okay. It is an indicator of recent malaria transmission. Number of infants showing malarial parasite in their blood film.
Question 32. What is the health insurance package provided for an eligible family per year in the Ayushman Bharat scheme? Here are the options. A. 5 lakhs per family per year. B. 4 lakhs per family per year. C. 6 lakhs per family per year. D. 3 lakhs per family per year. And the correct option is A. 5 lakhs per family per year. Here is the explanation.
Ayushman Bharat, if you remember, we had studied when we were talking about universal health coverage. Now, we'll just quickly look at 1 or 2 points. The other name for this is Pradhan Mantri Jan Arogya Yojana. Pay attention to the logo. Now, see, Ayushman Bharat was launched in 2018. It's still running, okay. It is an ambitious project or ambitious initiative of the current government. Okay. Now, the important thing over here is that look at its logo, different shades of green. Okay. Now, in this, what was happening under this Ayushman Bharat? Okay, we were trying to cater to primary level also and also to secondary and tertiary levels. Okay. So when we are catering to primary level and secondary and tertiary level, how are we achieving this? So for that, let me quickly draw for you something, okay? So we are catering to all the three levels, primary, secondary and tertiary levels. At the primary level, under this initiative, what is being done? Upgrading the existing, okay, we are upgrading the existing sub-centers and primary health centers to HWC. If you remember, what is HWC? Health and Wellness Centers. Okay, Health and Wellness Centers. And these health and wellness centers, we have broadened the range of services. Okay, broadened the range of services offered. Okay, what has been done? Broadened the range of services offered. Meaning that initially, we were more focused on providing RMN-CH plus A facilities. Okay, but now along with that, we are targeting NCDs as well as Ayush facilities in these health and wellness centers. Almost 1.5 lakh health and wellness centers have to be built. So at primary level, we are existing the range of services offered under Ayushman Bharat. What about at secondary and tertiary level? So at this level, everybody, we are providing what? At this level, we are providing, the government of India is providing financial protection. In the form of what? Insurance coverage. Okay. Earlier, in primary healthcare, we never talked about financial protection. Here we are talking about insurance coverage, okay? And that is in the form of National Health Protection Scheme, or we also call it as Modi Care. So how much is this financial protection? Rupees 5 lakh per family per year, okay, if the criteria are being fulfilled. Number of family members is no restriction. Okay, so and this services is only being provided for IPD services, inpatient services.
Question 33. The term demographic bonus is due to the. Here are the options. A. Decline in dependency ratio. B. Increase in dependency ratio. C. Increase in population. D. Decrease in population. And the correct option is A. Decline in dependency ratio. Here is the explanation.
Here there are two important definitions which can come as MCQs, okay? So bonus is definitely a PYQ and these are again expected MCQs in our future exams. See, bonus and burden. How can you remember this? Now see, if you look at bonus means something which is like whenever there's festival we get additional payment or something, yeah, some sort of incentive. So that is bonus. What is the additional advantage that we are getting? So there is a term which is known as demographic bonus. So what is this bonus? Bonus means decline in dependency ratio. It connotes the period when dependency ratio in a population declines. This is important, okay? So bonus means decline in dependency ratio. That's the bonus. What is the added advantage? If somebody asks you bonus over here means added advantage, okay? So what is like just to understand, so what is the advantage? The decline in dependency ratio because of decline in fertility.
Question 34. What is the largest fund for population and reproduction related programs? Here are the options. A. World Bank. B. UNFPA. C. UNESCO. D. UNICEF. And the correct option is B. UNFPA. Here is the explanation.
UNFPA. This is very important. A question has come on it. United Nations. See, these are all agencies of United Nations only. Okay. So this is what United Nation Fund for Population activity. Now, as the word suggests, or as you can see, it is United Nations Fund for Population Activity. So it is dealing with what? Population control. It's manufacturing new contraceptives, population control, health education, all that. And since it's starting with the UN, where is the headquarter of this? The headquarter of this is again in New York. And this is dealing, its main work is to control the population. Please have a look at the logo. It's very, very specific. Okay, so if you have to talk about it, UNFPA again was framed in 1967. It's subsidiary organ, I told you, of United Nations. It's addressing the population growth. So like I said, manufacturing contraceptives, okay, develops nations' capability to manufacture contraceptives aimed at improving reproductive maternal health, and it's also developing what? Population education programs, okay.
Question 35. In rural areas, one ASHA worker is assigned to a population of people. Here are the options. A. 500, B. 1200, C. 2500, D. 1000. And the correct option is D. 1000. Here is the explanation.
Village level, who are promoters of family planning, village level, who are promoters for family planning, everybody. So at village level, those who are promoters of family planning are the ASHA workers. Again, those who are working at village level. Okay, trained DIs. Now, instead of calling them DIs, we call them TBA. Okay, if you've learned this with me, okay, they are what? Trained birth attendants. Okay, what do we call them? TBAs, trained birth attendants. And also we have village health guides. Okay, ASHA, you all know, is present 1 per 1000 population. Yes, trained DI is also 1 per 1000 population. Trained DI ko better word is trained birth attendant. Village health guide 1 per 1000 population. They are also spreading awareness about family planning.
Question 36. Incidence is best measured by. Here are the options. A. Cross-sectional study. B. Cohort study. C. Case control study. D. Double-blind study. And the correct option is B. Cohort study. Here is the explanation.
Like which study is called as correlational study? I'm just putting here ecological study. This is like a high yield point. Why it is called correlational has been discussed when we've taken up the discussion of ecological study. Prevalence study is which one? Cross-sectional study. Okay, that has also been discussed in cross-sectional. Case reference. Please remember, don't get confused with case report and case series. Case reference is actually a case control study, and incidence of follow-up study is a cohort study. You will be seeing the application of all of this. This was just a high yield point in between.
Question 37. Zika virus is transmitted by. Here are the options. A. Aedes aegypti. B. Culex. C. Anopheles. D. Phlebotomus puptasi. And the correct option is A. Aedes aegypti. Here is the explanation.
Zika is single-stranded RNA flavivirus. Most important vector, Aedes aegypti. Most common in India, although Aedes albopictus can also be reported. Okay, that is very, very important over here.
Question 38. Which of the following is a rabies-free area? Here are the options. A. Sikkim. B. Kerala. C. Lakshadweep. D. Jammu and Kashmir. And the correct option is C. Lakshadweep. Here is the explanation.
That is rabies not found at certain places? Yes, any place which is bound by water, okay, we don't find rabies. Australia, Cyprus, Iceland, Ireland, Malta, Japan, New Zealand, Britain. This one, please remember, is a PYQ. In India, it is not seen in Andaman, Nicobar Islands and Lakshadweep. And also, Goa is one of the places in India which is going to be declared rabies-free very soon.
Question 39. At what point in time is the population assessed for the calculation of the crude birth rate? Here are the options. A. 1st July. B. 1st January. C. 31st December. D. 1st May. And the correct option is A. 1st July. Here is the explanation.
Crude birth rate, everybody. What is it? You will again be discussing this in fertility indicator. So remember, it is the total number of what births? Total births or live births? only live births, okay, total number of live births per 1000, the multiplier is 1000, per 1000 estimated, which your population? Mid-year population, okay, per 1000 estimated mid-year population. And guys, when do we consider mid-year population? On the 1st of July. Very, very important. All this is PYQ. And I'll just put over here also, as per the latest SRS data, okay, the current crude birth rate of India, current CBR of India is how much? It is very good, 19.5 per 1000 mid-year population. Earlier it was 19.8, so now it has become 19.5.
Question 40. The study of social causes is called. Here are the options. A. Sociology. B. Social pathology. C. Society. D. Community. And the correct option is B. Social pathology. Here is the explanation.
It is the study of social causes, okay, it is the study of social causes leading to the occurrence of a disease, okay. What is it? It is the study of social causes leading to the occurrence of a disease. Like, can you give me some examples? Peer pressure, it is a social cause, okay. Stress, it is a social cause, okay. Poverty, it is a social cause which can lead to the occurrence of a disease, okay. Then migration, or you could also say, for that matter, industrialization, okay. Now you see that there are so many people who are migrating from the villages and coming to the cities in search of work, but unfortunately it's not necessary that they will always land up in getting work. It's not necessary. So again, that puts them in a lot of pressure, okay. Migration, industrialization, our personal habits of like smoking, drinking, so all these are what? Social causes which is leading to the occurrence of a disease. So poverty, illiteracy, migration, industrialization, all these are what? Social causes leading to the occurrence of a disease. Smoking, alcoholism, criticism, gender bias, child labor, prostitution, okay, all these things, okay, can lead to occurrence. Drug abuse, juvenile delinquency, suicide. So all these are studied under social pathology.
Stay connected with PrepLadder by subscribing, as we have a bunch of interesting content planned for you guys. We extend our best wishes to all the FMGE aspirants. Own your dream.